Et j'ai maintenant l'honneur de vous présenter Andrea Scarpa de Venise, qui est membre donc de notre groupe interne, si l'on peut dire, du Genius System déjà depuis un petit moment, qui a commencé à faire des cours sur le Genius System et qui aujourd'hui va vous parler.
Okay.
Andrea, in what language are you going to speak? Italian?
I will try English.
Ah, il va parler English. Il va parler en anglais.
I will try.
C'est bon. Thank you. I leave you.
Thank you.
Thank you. You know you are going to be quite quick.
Yeah, absolutely. So, hello everyone. First of all, I want to thank you, Charlie, for inviting me in this amazing place. We don't have the connection. Yes, here, from here. And this is the first Genius Summit in which I participate, so it's a very big honor for me to be here, and thank you to you and all your marvelous staff. Okay? So, I'm the last, I will try to be not the least, and no problem? No? Okay. And as quick as I can, so let's go on. This is me, but we don't have time. Just to remember my European Board of Certification with the past president of EOS, Dr. Laspos, a very good friend of mine. And this is the argument that I am trying to develop for you today. And this is about the management of the anterior volume. And so the question is what we can do with our ortho to get the best result that we can get, of course. And so it's a very complex argument, and 20 minutes, it's not enough probably, but I will try to focus, to underline some concepts that for me are fundamental. And as you know, most of you know me, as you know, I like to fix these concepts showing some clinical cases, some few cases, and so I try to do it. I try to do my best, and then of course if you have some question, I'm here to try to answer to you. Okay, so a few cases, and let's go with the first case. Here we have Giorgio, is a boy of 18 years old. These are the extraoral photos, and you can see the skeletal class 3 tendons and straight profile, little bit concave, irregular smile. And these are the intraoral photos, and you can see a very important thing. So the altered proportions and the irregular gingival margins, that are things very important to be analyzed before you start the treatment. And of course, here we have, as you can see, the lower crowding. And here, this is the first concept that I want to share to you. When you have patient with altered proportions, now you have to use the modern technology. So digital smile design is not the future, it's the present, absolutely. And when you have a case like this, it's mandatory to analyze the case also with this digital technology. So digital smile design, and here you can see that the teeth of this patient are thin and long. And you have to consider absolutely this before you start with the treatments. Here we have the X-ray, lateral and the panoramics, and here the cephalometics data. And of course is a class 3, skeletal class 3, and we can see by the index, the width index. And of course, as in every third class, we have a little bit of retroclination of the lower incisors. It's normal. And which could be the ideal treatment plan for a patient like this, with this malocclusion. And of course, it's a class 3 scared of class 3, we could think about surgery. Maybe honestly, surgery in a case like this is too much. And I think that everyone in this room is agree with me, too much. And especially because the perception of himself, of the patient, is a good perception, is an handsome boy, so surgery is too much. So which could be the real treatment plan? Of course, we have to align the upper teeth and thinking about reshaping our veneers because he has altered proportions. And we have to solve the lower crowding. And so, for example, extraction of the lower incisors or APR. And we are in a class 3, so we have to think about a camouflage, aesthetic camouflage. And when you have a class 3, you have to flare a little bit the upper incisor, but pay attention and remember what our super colleague Bilal said yesterday. So in a case like this, the important final result, it depends from how to get the right position of the upper incisor. So the control of the torque is very important in a case like this. So what about the treatment plan? And this is, for me, in my opinion, the best question, the most important question. What the patient look for. You could be the best ortho in the world. You could do the best treatment in the world. But if you don't center the need of the patient and the request of the patient, surely it will be a failure. And this is a very big problem. So we have to consider that, first of all. And about this, the patient, he wants to solve the lower crowding and improves his smile. He doesn't want veneers, so he decided everything. Of course, you can discuss with the patient your treatment plan, but this is a very important starting point. So my treatment plan is Genius system, the best system that you can use. Extraction of one lower incisor. We have an adult patient. We have a class 3, so we have a crowd in the lower arch. So this is a very good solution. And then, because it doesn't want veneers, reshaping of upper incisors and some restorations, because we want to get the best proportion finally we can get. So I start with the upper arch, with Genius system, and begin to solve the crowding. And then I apply the braces on the lower arch. And here, as I do in my extraction case, I put the braces even in the tooth that I will extract later. And this is because for periodontal reason, to save the bone and to maintain the bone. Because if you move the tooth from the beginning, it's better. The extraction will be easier, okay? This is a very important advice for you, for me. So I made the extractions and I begin to close the space, nothing special. And this is for you. It's a very interesting article in which fundamentally it says that you can decide to do IPR or extractions. It depends from many factors. It's a long speech, but however, both the decisions are good decisions. It depends from a lot of things. For example, the shape of the incisors. And here we have a problem with some rotations, nothing special. So we re-bracket in the 33 and the 43 elements to get the best rotation we can and go on with the leveling. And this is the final result. Really not a miracle. It's a good result, especially because the patient need was exactly this. And so I do my treatment, I close the space, I solve the crowding in the lower arch. And another thing that is interesting for you, I think, is the perception that technical have about beauty of the smile and layperson. And you have to know that we, orthodontists or prosthodontists and general dentists, we are all focused about black space, black triangles, diastemas. And the layperson, they are really centered about gingival and gum tissue. So it's completely different in the perception. And here we have the final photos. Of course, we have an improvement of the smile of this patient. The comparison is good. I repeat, nothing special, nothing miracle, but it's what you can get if you are able to know the problem of the patient, the proportion of the patient, dental proportion of the patient. And so let's use the modern technology, let's use digital smile design. And then another comparison. And here, another case, more complex case. Here we have Claudio, 13 years old boy, and the extraoral photos, skeletal class 1, hyperdivergent, irregular smile, and as you can see from this picture, he has the upper laterals missing. It's a very common situation. This is the reason why I want to show you this case. It's a very big argument, and the question, the usual question is, we have to close the space or we have to open the space for implants. It's a very complicated thing, so I don't have time to explain all these problems, but I want to share with you some aspects. So, here we have the intraoral, class 2 molar, the spaces, and the lower crowding. This is a very important article for you. You have to know that when you have congenitally missing laterals, you have also altered proportion, especially about the upper incisors that are smaller. And you have to know that, because if you planned before, for example, to do restoration or veneers, you have to know where to put the teeth at the end of your orthodontist treatment. Another article, the same conclusion. This is from my best friend, Davide Mirabella. I made a lot of courses with him. And Kokic, that is, for me, the best, absolutely the best orthodontist, especially when we speak about aesthetic dentistry, aesthetic ortho. And here, the laterals, and you can see how much the upper incisor is retroclined, so negative torque. So very, very, very critical case. And again, this is the cephalometrics data, and you can see how many retroclined is, how much retroclined is the upper incisor. And so, again, which could be the ideal treatment plan? For me, there's a little bit of bimaxillary retrusion, so could be an advantage, aesthetic advantage for this patient to do some surgery, some bimaxillary advancement of the bone, and then probably, in a case like this, the best solution could be to open the space, to create the space to do implants. But again, which could be the real treatment plan, except surgery? That is a very critical question to our patient, to do to our patients. Extraction of lower incisors, APR or proclination, and then open or close the space, veneers and restoration. The same question. I don't want to repeat this, but it's a very critical moment. What the patient look for. And if the patient doesn't say nothing, you have to ask the patient what he wants from his treatment. This is very important for your goal and for your success. The communication first. And so he refused surgery. He doesn't want implants. He wants invisible appliance, and I want to kill myself because it's a very difficult treatment with this kind of retroclination of the upper incisors. And you know, I made a lot of treatment with lingual appliance, and people know that. So a lot of people come to my office asking for this kind of treatment. And for me, it's a problem because I do that. And so I decided to proceed with lingual system, extraction of lower incisors, and to close spaces, because he doesn't want implants. But I told him, okay, no implants. I will close the space for you, but you have to follow me in the finishing of your treatment, ortho, because we will do absolutely, this is mandatory for me, veneers on the canine, restoration, minimum restoration on the bicuspids. Veneers is probably the best solution. However, let's go. In a case like this, the second message that I want to share to you is the importance of digital setup. You have to do this because you have to visualize exactly where to put the teeth at the end of your treatment. It's a very important thing. And so I visualize this kind of treatment, and then I have to do that. So this is the digital setup. This is the lingual bonding. And here we have the imaging of the final result of my ortho. And the question is, Andrea, it's a good result for your ortho? It's a very critical question, but I don't want to lose time because we are all tired, so I want to go on quickly. And so, from a point of view, from a gingival point of view, it's a beautiful result because I put the teeth exactly where I want with my ortho. So, high, low, high, the perfect gingival margins leveling. Another things that I anticipate to you is that even if you do the reshaping of the canine during treatment, and I always do it in a case like this, you have a problem. The problem is this. The problem is that even if you do a very good reshape, the canine are darker than the laterals. So veneers or restorations, better veneers, are mandatory in a case like this. And then the other aspect is the first bicuspids that you have to transform in a canine. And you know, this is a very good leveling of the gingival margins because the gingival margins of the canine has to be higher. But you know, the premolars is smaller than a canine. So you have to consider the restoration of that tooth. Need restoration. And again, we have black triangle. When you decide to make an extraction of a lower incisors, you have to know that this is a very common problem. And it's not about your quality or your treatment, or how to are able to put the root of this teeth. It depends from many factors, but you have absolutely this possibility. And when you finish your treatment, you have to know that could be this problem and you have to solve it. And here we have the final result of the upper arch with veneers and restoration. It's a very good result, but we have still the black triangle and it's a problem. So we have to solve. And we have to discuss before with the patient about this possibility. And another time, and Bilal said you yesterday in a very good way, it depends from how is the exposure of the lower incisor during speech and during smile. You have to consider that before you start with the treatment. So fix the retainer, and then the comparison with the digital setup, and I'm, of course, happy about my results. Here we've done the restoration. We closed the space with the black triangle, and I'm really happy. So the final result with ortho and the final result with veneers restorations and the closure of the black triangle the comparison, and you can see this patient, when he smiles, he shows completely lower incisors. So you have to consider before you start with the treatment. However, this is a very good result. It's a very difficult treatment, believe me, because with the lingual technique, I don't have perfect genius torque control. I have my lingual appliance. I need extra torque in this case, in the upper incisors, and I need bands. So very, very, very critical treatment. And of course, genius system could be better. However, the patient is happy, and we are happy. So the comparison, and here we have, and this is what I said before, control the quantity of exposure of lower incisors during a smile. So here we have the comparison. The roots are parallel, so I'm happy. And this is the torque of the upper incisor. It's a little bit better, but it's difficult to do this with this kind of treatment. And again, we travel from 95 to 105. It's good control of the torque. It's a very important thing, especially because I don't use many implants. I just use the torque, the information of my arch, of my braces and elastics. Very simple ortho. Okay? And this is my last case that I want to show because it's a very common case. It's one of the problem, the present of spaces that bring the patient to our office. And it's a very simple situation for us to close the space with a magnificent result for the patient. We can change the life of that patient, but in a very simple, with a very simple treatment. So let's see this girl, the particular of the smile. The diastema spaces are very anesthetic and unpleasant for the smile. And you can see these intraoral photos, the milk, the presence of the milk canine. So we have probably an inclusion. And I will show you, this is the lateral scarotic tendency, hyperdivergent, nothing special. The inclusion, this is a very simple inclusion, so it's not a problem to solve for all of us, this kind of inclusion. And what about the treatment plan? Here we don't have ideal, real, it's simple. Align and close the space. But the very important challenge in a case like this is to calculate, this is the moment of the surgery, this is our genius applied in the upper as in the lower. And this is the way in which I create, simple way, in which I create from the beginning, because I know from digital smile design, I know from my digital setup, I know that the laterals, and this is the goal of this treatment, the laterals of that girls are smaller than normal. You have to calculate exactly the final position. And so this is the way I commonly use to open the space. And in that case, you can see that it's a really simple case, just using open coils from the beginning to open slightly distally to the lateral superior some spaces for veneers or restorations. It depends sometimes from the economic possibility of our patients. But we have to create the space, and then first restoration, and then after 5-10 years, veneers. But you created the space, the right space. Very simple way. This is the end of the treatment. Simple treatment. The comparison. But what I love to show you, this is the zoom that we have to estimate in a very good way. The difference between excellence or a normal treatment is all in that zoom. But now we have absolutely the possibility to calculate and to estimate before we start the treatment. And this is the smile of that girl after. Simple treatment, but super result. We change completely the beauty of this girl. And of course, this is the difference. She seems to be another girl. So I'm really happy. And the laterals are bigger. Restorations, not veneers, but are bigger, and then the proportions are better than before. And this is just a thing that I want to share with you. This is our new assistant in the office. This is a progress case, and she's a very pretty girl, Vito, 22 years old, and this is her photos. She's a very pretty girl, and she is also a very good assistant. And these are the intraoral photos of that girl. And she began to work with us, with my father and my brother Daniele, that is in the corner, that is filming me. And I hope to be not so fat, but however, these are the photos, and you can see that is a critical case in which we could do maybe extractions. But he bring me in a corner and told me, "Doctor, I have a very important problem, because before I started to work with you, I went to another orthodontist, and he told me that I need extractions of 8 teeth, the winsome teeth, and the 4 first bicuspids." And I told her, "Okay, let's give a look, let's visit, let me see what I can do for you." Of course, we have the periodontal situation that is not so good. We have a lot of crowding in the lower and also in the upper arch, but I saw this. He has very big teeth, and he has a very big lower incisor and very triangular shape. So it's ideal proportion to do APR without distractions. So I begin the treatment with my super genius system, and this is the progress after 3 months. And so I'm really happy to show this. And this is the problem. The case is solved. Of course, I have to work a lot because we are at the beginning of the treatment, but however, I'm really happy about this without extraction. And I tell you, if I have to extract, I extract. I do not have any problem to do extractions. And so she's really happy. So, I finished with my presentation. I want to underline this fact, but I know that my colleagues told about this. And this is a very good program. This is the first Genius Master. We have the second schedule. So let's take information. And I finished. This is my appointment with the Genius Master. Thanks for attention. And now, finally, let's have fun.
Merci beaucoup.